Gurgaon, and uh, unfortunately, I could not connect with you all last week because there were some babies coming into this world, and the same is the situation today also. I've had one baby already delivered, one is on its way, but I still thought that I'll not miss this week connecting with you all because the topic that I was going to speak on is a little out of the way. Okay, so today I'm going to talk to you about the descent of the uterus, which is actually prolapse, called as prolapse of the uterus. So, your uterus or the bag that you have in your body, which carries and grows the baby, is in the lower part of your abdomen, in your tummy. Okay. Now, this uterus is held up by a lot of supports. We must remember that there are two or three very strong supports which hold the uterus in place, where, you know, attached to the wall of the pelvis, wall of the bones of the pelvis. Okay, now prolapse is actually descent of the uterus. That whenever these supports of the uterus they become weak or they become stretched out and they are not able to hold the bag in position, then the uterus descends down through the vagina, and usually the lady is able to see or feel the mouth of the uterus lying outside the vagina. So this is called prolapse of the uterus. Now, why does prolapse of the uterus usually happen? So there are two kinds of prolapse. One kind of prolapse is when the mouth of the uterus is very long. So although the supports of the uterus may all be intact and strong, the mouth of the uterus is very long, so it comes down through the vagina and completely can be seen outside. Now that is called a nulliparous prolapse, or a prolapse in a girl who's never delivered a baby or who's never had a childbirth. Okay, because in that situation the ligaments are not going to stretch, they're not going to become loose, but still she's got something coming out of the vagina, and that usually happens when the mouth of the uterus is very long. Okay, so that is called nulliparous prolapse. The other most common kind of descent of the uterus is when the supports of the uterus become very weak. Okay, so the uterus is supported by a lot of ligaments, the round ligament, the McEnroe's ligament, and these are very strong supports which are holding the uterus up in place. Okay, now supposing these supports become stretched out, like in childbirth, in pregnancy, when the ligaments of the uterus are stretched out when the uterus is growing. Okay, so that is one position where the uterus supports of the uterus will stretch out. Ideally, after the birth of a child, all these supports they come back to their normal size. But in some women, see, try and imagine a rubber band. Okay, there are some good quality rubber bands, there are some bad quality rubber bands. So same way, there are some tissues that are very stretchable, like they stretch, and when you leave them they'll come back to their original size. But there are some tissues which when they stretch, they remain stretched to some extent and don't completely come back to normal. So in women in whom these ligaments or these supports of the uterus, they don't come back to completely normal, in these women the chances that the uterus might descend into the vagina are very high. So that is one reason. The other reason is normal deliveries. Now honestly, normal delivery is a very good thing to happen. It's very, very good thing to happen because it is one of the most natural and most beautiful things that God has created for a woman. The birth of a child through the natural birth passage, right? But sometimes what happens is that before the mouth of the uterus is completely open, before the the baby is actually ready to be pushed out, the mother starts getting a sensation of pushing, and she pushes the uterus, pushes the baby prematurely. A premature pushing of the baby will also pull the uterus along with the baby down. And then after the childbirth, uh, later on, the lady may develop a prolapse or multiple childbirths, multiple normal deliveries. So these days we get to see very less of prolapse because somehow most of the women either undergo a cesarean, the rate of cesarean has gone up tremendously, or the uh, either the cesarean is more, or the way in which the baby is delivered is much better and safer. because most of these women deliver with an obstetrician or with a doctor. So the doctor knows when to tell the lady to start pushing the baby out, right? Otherwise, supposing there is premature pushing, again the uterus will descend. Earlier, say 60 years back or 50 years back, it used to be the guys used to be doing the deliveries. Most of these women used to be having home deliveries. So at that time, there was nobody to tell them when to start pushing the baby out. So usually they used to start pushing the baby very prematurely, and that used to kind of pull the uterus down also along with the baby. So these days, generally, we see prolapse in women who are more than 40 or more than 50 years old, more in women who have had normal deliveries, in women who have not been to a hospital at the time of childbirth, or in women probably where for some reason or the other there was premature pushing and the delivery, the baby was being pushed out along with the dragging of the uterus. Okay, so these are the most common causes of prolapse. Now, what are the signs and symptoms? Like, what will the lady feel? So, in case you feel that there is, and also remember that whenever the uterus descends, right, whenever the uterus comes out, it usually drags along with it a little portion of your urinary bladder and a little portion of your rectum or your potty ka rasta. So, your pishap ka rasta also and your potty ka rasta also gets pulled down along with the descent of the uterus. So the symptoms that you might experience are sudden leakage of urine, थोड़ा सा cough किया या walk करने में severe है तो the urine may leak out a little bit. So that is one symptom. The other symptom may be feeling of incomplete passing of potty. Like you have gone and you have passed potty, but you're still feeling as if कि अभी भी है. Then after some time you go and you pass some more, and then you feel completely relieved. So a feeling of incomplete evacuation and a leaking of the urine on straining. So coughing, walking, squatting. If there is sudden leakage of urine in these situations, then you might suspect that there may be some descent of the urinary bladder, and maybe your uterus is trying to descend and come out. And if it is a very severe prolapse or a grade 2 or a grade 3 prolapse, then you may actually see the mouth of the uterus coming out of your vagina. So these are the basic symptoms that you may feel when the uterus is descending down into the vagina. Now, how to prevent this? Okay, first let's talk about prevention. So prevention, like I said, that childbirth. So the doctor has to be careful in childbirth that she's not causing premature pushing of the lady, so that the lady is dragging her uterus down. The second is perineal exercises. So generally after your delivery, you should take some postnatal yoga classes where they tell you some Kegels exercises, where they tell you exercise to tighten the muscles of the perineum, the floor of the pelvis, right? So that all the tissues find it easier to come back to normal elasticity and normal shape and size, and there are no loose tissues left which might cause a prolapse of the vagina. Okay, so again, I'm back online. The net is back online. Okay, so I was talking about treatment or prevention. Prevention is that. Okay, so you don't prematurely push. You do proper perineal exercises after a delivery, and at the earliest sign of you feeling a dragging sensation or something coming out or a leaky urine, go and see your gynecologist so that she can immediately advise you these exercises, and they can help restore your normal vaginal anatomy. So if the prolapse is not very severe, sometimes these days they have some kind of laser therapy also, where they put something in the vagina which releases some kind of electronic vibrations which tighten the muscles of the perineum. How much that is effective is still under study. We are not very sure how much it restores the tissues of the vagina, but it can be tried as an option. So these are some methods in which you can probably try to see that you can prevent a prolapse from happening. Now, supposing your prolapse has already happened, okay, then it depends on the degree of prolapse that your doctor will ask you to manage. If it is not a very severe prolapse, maybe we can still continue managing for some time with perineal exercises. But if the prolapse degree is very high and you're discomforted, you're uncomfortable because your urine is constantly leaking out, or there is something coming down and the dragging sensation is troubling you, then you might need to go in for a surgery. So there are two kinds of surgery for a prolapse that we can do. Supposing you want to plan a baby in future and you have a prolapse, then we would like to restore the anatomy of the uterus. So we'd like to push the uterus back and stitch all the tissues back together, strengthen all the ligaments and the muscles so that the uterus remains inside, and if you want to plan a future pregnancy, you can plan. The other way is in very old ladies in which the prolapse is, very severe and they have completed their obstetric career. So in those women, it is easier to do a vaginal hysterectomy, in the sense removal of the uterus through the vagina. So that is another method of managing prolapse. And when we are managing, or when we are trying to restore the anatomy, it also means that we will try to restore the anatomy by stitching the bladder tissues, or the urinary bladder tissues and the rectal tissues also back in place. So we will be doing both. We will be not only restoring the uterus in place, but we
maintain social
So
distancing.
we have another
2 meters
announcement.
from each
2
other.
minutes we will wait
Wear
for
your
this
mask
announcement
from
to end.
homes to gym. Do not remove mask.
In the
when
meantime,
talking
if you have
to
any
the
questions, you can please put them
नमस्कार।
here so that I can
कोरोना
answer them
वायरस
for
से
you.
बचाव के लिए कृपया अपने हाथों को नियमित रूप से साफ करें। एक दूसरे से करीब 2 मीटर की सामाजिक दूरी बनाए रखें। अपना मास्क नाक से चिन तक पहने। बात करते समय मास्क न हटाएं। धन्यवाद।
Okay. So usually women tend to ignore this problem. They feel कि ये normal है, natural है, अपने आप ठीक हो जाएगा, हम exercise कर लेंगे, हम ये कर लेंगे. But please, women, life is good. Okay, and do not suffer these problems. There are very simple solutions for most of these problems. Even the surgeries that we do are not very difficult and life threatening and worrying, and they usually can be done safely. Post surgery, you become so comfortable that you will wonder why you never came earlier. So please, for heaven's sake, whenever you have a problem like this, do not hesitate to come and at least visit your gynecologist. She will tell you if you really require the surgery or not. In very, very old women in which there is prolapse and they are unfit for surgery for some reason or the other, there are some pessaries also we can use, some rings which we can put into the vagina and which will hold the uterus up for the time being till they can probably get fit for a surgery, or if they are absolutely bedridden and unable to come for a surgery and perform a surgery. I would really not recommend the vaginal ring or the vaginal pessary for women who can get a surgery done, because it is very uncomfortable, first of all, to use the ring. Secondly, the ring also has its own complications like infections, and sometimes the ring may irritate the wall of the vagina and cause ulcers there. So I would not recommend the vaginal ring for women who can get a surgery done. A surgery is a better option as compared to the ring. Okay, so whatever it is, whatever problem, any difficulty in passing motion, a dragging sensation in your pelvis, you've had previous normal deliveries, and if you're seeing some lump or some swelling at the mouth of your uterus, please come and see us. We'll definitely try to see how best we can help you. The surgeries can be done through the abdomen also, surgeries can be done vaginally also, and there are multiple options. These days we have some slings also which we can use to put the uterus back up. So all these options are there for you, and there's a cafeteria of options. So just visit your gynecologist if you face any of these kind of problems. And any questions, because like I said, I have a baby coming on the way and I would like to really close this session a little quickly. Gunjan, okay. Lot of urinary problems, and the most common in urine leakage. Yes, see, every urine leakage is not a sign of uterine prolapse, right? Sometimes the walls of the vagina also become very loose and lax, and because of which the angle between the urinary bladder and your urethra may change, and that also may cause a little bit of leakage of the urine. So it does not mean that you have a prolapse every time you have a urinary problem. That is one of the signs of a prolapse, but it does not mean every leakage is not a prolapse. It may be a UTI, or it may be just a little bit of bladder descent, which can be repaired very easily. Okay, so in case you have a problem like this, you must visit your gynecologist. She can put in a sling or something like that, and it just make you comfortable. Don't bear this problem. Come and see us. Come and see us, Gunjan. Hina, a sense of heaviness in my vaginal area, and sometimes it bleeds also. No, 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 no. So, heaviness and bleeding may not be prolapse, it may be some ulcer on the mouth of your uterus or some kind of an infection. Please do not ignore it. Come and see us. Come and see us. That is not the exact sign of a uterine prolapse. I will not say it is a prolapse. I will say that it's probably an infection, and because of an infection, an ulcer on the mouth of the uterus, and you need to see us immediately. So, Hina, please come. Any other questions? Madhvi. So, what happened when someone delivered premature and appendix removal? Is this problem? No, appendix removal does not cause prolapse for sure. And premature delivery also will not cause prolapse. Like I said, premature pushing. So, normally we advise the mother to push the baby out only when the mouth of the uterus is completely open. Now, supposing the mouth of the uterus is not completely open, and at that time the lady is pushing the baby out, that is the time she is dragging the uterus out. So, premature delivery will not cause prolapse. Removal of appendix will definitely not cause prolapse. Madhvi, don't worry. Anybody else? Priya. Ma'am, if a woman is dealing with uterine prolapse, and what are the risk factors during pregnancy? Okay. So if you have a prolapse, usually we see that because of the baby growing inside the womb, the prolapse kind of completely disappears in pregnancy. Because the baby grows outside of the pelvis, so the baby actually holds the uterus up for the duration of the pregnancy. And the problems only happen after the delivery of the baby. Delivery can be normal, can be cesarean. That is not an issue. That is for your obstetrician to decide. But post-delivery, then you may need to get some kind of repair surgery done to deal with this prolapse, Priya. So if you have a prolapse, conceiving is not a problem. Carrying the pregnancy is not really a problem because the prolapse actually disappears in pregnancy. But post-delivery, you may need to attend to it. Okay? Any more questions? Madhvi, why premature delivery happened before 10 weeks? Well, 10 weeks earlier. So there are a lot of reasons for preterm labor to happen. That could be blood flows to the pregnancy, maternal indications, fetal indications. Maybe your baby is not growing well. Maybe the mouth of the uterus is not very strong to hold the baby in. So maybe the contractions have started prematurely. That's an entirely different topic. Maybe I'll do one of these Facebook sessions on causes of preterm delivery, and then maybe I can answer all these questions for you. Okay, Madhvi? Okay, thank you so much, everybody. And I'll be back next Thursday. And please put in your requests on what topics you would like me to discuss so that I can see what I can speak on. Thank you so much. Thank you very, very much.